All right. Good morning. Buenos días. We're so glad that you've joined us this morning. We're going to get started in just a moment. Vamos a comenzar en unos momentos. Welcome. All right. Welcome, everyone. We're so glad that you're here. We are live and in person from beautiful Elizabeth Learning Center in the city of Cudahy. Am I correct? Are we in Cudahy? Okay. City of Cudahy. So thank you, Elizabeth Learning Center, for hosting us. There's so much going on. Gracias a la escuela Elizabeth Learning Center, que estamos en su centro de padres en ese día. It's okay. Muy hermoso. El 1 de mayo. Ya estamos en mayo y estamos aquí en la ciudad de Cudahy. Vamos a comenzar. Gracias. All right. So my name is Megan Guerrero, and I am one of the Family and Community Engagement Administrators for Region East. Soy la señora Guerrero, soy una de las administradoras del involucramiento de padres aquí en la región este. Nuestras oficinas se quedan en la Soto, cerca de la Valley. Ahí estamos con el superintendente de la región, señor Huerta, en sus oficinas, apoyando a todas las escuelas de la región este desde Cudahy, Southgate, hasta Eagle Rock, Highland Park, en el centro de Los Ángeles, MacArthur Park también estamos, toda la región este. So we are in the Region East. Hello, Region East. We're so glad if you're joining us from any one of our networks of schools. We are, Region East covers Cudahy all the way to Highland Park, Eagle Rock, MacArthur Park, downtown. And we're so glad you're joining us today. And this is our team. You'll see many of them here supporting in the webinar, our coaches, our PESAs, and supporting with your questions as well. Supporting your community representatives. Welcome. Come in. Bienvenidos. So what we're going to do next is set up our translation. We want to make sure that those of you joining us on the webinar, and I wanted to welcome, I see some folks in the chat. Do we have any schools hosting watch parties? That's something that we do where schools like this virtually invite their parents to come. So let's see if any of our parent centers are joining us this morning. ¿Algún centro de padres por ahí, por la región este, uniéndose con nosotros hoy día? We have Nueva Vista. Bienvenidos, bienvenidos. Bell High School. Should come on over. Vénganse. No está tan lejos. We're glad that you're here, though. Everyone feels more comfortable in their home school, right? Oh, El Sereno Elementary. Welcome. Welcome. We're so glad that you're here. Thank you for joining us this morning. If you can let us know how many folks are with you in your watch party, si nos pueden dejar en el chat cuántos están con ustedes en su centro de padres, lo podemos anotar aquí. And First Street Elementary, welcome. Awesome. All right, let's get our interpretation set up for those participating in the webinar. We, if you're on a laptop or a computer, you can click the globe icon on the bottom of your screen and select your language of preference. The two languages we have today are English or Spanish. So you're going to engage and listen in the language that you select. Si están en una computadora, por favor, hagan clic en el símbolo del mundo, del globo, y pueden seleccionar el idioma que le gustaría escuchar el día de hoy. Tenemos opciones, son inglés o español. Usted participará y escuchará la presentación en el idioma que seleccione. If you're on a mobile device, you're going to select the 3 dots that say more and choose language interpretation. Choose English or Spanish and then click done. Si están en su aparato móvil, si están en su teléfono, van a seleccionar los tres puntitos donde dice más, seleccionar interpretación de idiomas, seleccionar el idioma que prefiere para el día de hoy, inglés o español, son las dos opciones. Y luego hacer clic donde dice finalizado o done. Vamos a poner las instrucciones también en el chat para que las puedan ver. We'll put the instructions in the chat as well so that you can be sure to access the language of your choice, be it English or Spanish today. Also, if you'd like to turn on the transcript or the captioning while you're listening to the webinar, you have the option to do so by clicking where the two C's, CC, select show subtitles, and then you can view the full transcript of the meeting. Pueden seleccionar también para ver los subtítulos. Si están escuchando de un lugar donde tal vez no pueden poner el volumen, pero quieren escuchar, quieren seguir la información, pueden seleccionar Live Transcript, donde dice CC, y seleccione Show Subtitle, los subtítulos, para mostrar los subtítulos y luego ver la transcripción completa. You can do the same thing from your mobile device. You are going to click on the three dots, click on Meeting Settings, choose Activate Closed Captioning. It's always that CC closed captioning. The captions are available in English. También si están en su aparato móvil, está en su teléfono, puede hacer clic donde dice Settings, Meeting Settings, configuración de la reunión y activar los subtítulos donde dice C. Pueden activar los subtítulos y están disponibles solo en inglés. For those of you on the webinar, for those of you in person, I can see you. You can clap or give me a thumbs up or slow down or pero if you're on the webinar, you can ask questions in the Q&A. We have folks in the room who can answer your questions today. We do ask that you be careful about sharing sensitive information about your child or specific information with names. But if you have general questions about this topic today, we are happy to address your questions. If you have a specific question and you don't want to share your child's information publicly, we can ask you to chat with us individually. And then you can also use the react button to show a thumbs up or clap or celebrate information. We know that today's topic is sometimes difficult to talk about, so you might not feel like clapping and celebrating, but maybe it touches your heart and it's something that that will help you have stronger conversations at home about difficult things. So we hope that that is that you're learning for today. So these are the learning objectives. Take a look at what we are going to be talking about today. Like I said, not an easy subject, but one that is so important to address. So we're going to cover information data on youth and drugs. We're going to talk about fentanyl. We're going to talk about overdose, naloxone, talking to your child, which we can all do better at, no matter what age they are, and also resources for families. So we want to make sure you walk away knowing where else you can find resources to support you. Because in that moment, you're not going to be able to call one of us. You need to know, I want to be ready. I want to feel prepared. I want to know where the resources are for me and my family. So let me introduce you to our presenters for today. We have expertise from our school sites, our school site administrators. We have expertise from our nursing department. So we have brought the experts to you to be able to share this important information. So our first presenter is going to be Mr. Antonio Roque. He is the assistant principal at Diego Rivera Learning Complex. And we also have Grace Gillen who the nursing coordinator for Region East. So she's part of our region as well, coordinating nursing. And also Miss Elizabeth Rodriguez, who's a nursing coordinator in Region East as well. And they are here in the space with us from nursing. And also Mr. Roque, who I'm going to have come up. He's going to be our first presenter. So welcome. Welcome to Region East and welcome to Elizabeth Learning Center.
Thank you. Thank you. And as was mentioned, my name is Antonio Roque, and I am the proud assistant principal at Communication and Technology School at the Diego Rivera Learning Complex in South Los Angeles. I am part of Region South, but I started my career here in Region East at Southgate Middle School, and then on to Nimitz. So I'm very, very well acquainted with Region East. And with that, I also like to say Happy Principal's Day because we are in a high school, and I just want to recognize the hard work that principals do every day. As was mentioned before, this is a sensitive topic. And many of our families are struggling in dealing with some of the challenges the substance abuse pose. And I just want to make sure that if there is something that we talk about or that we mention that may trigger some deep emotions, and you feel, if you're here in person, like you want to step outside, catch some fresher breath air, please feel free to do so. If you are joining us virtually and you want to, maybe shut your the camera so that you can get that fresh air, please feel free to do so. And with that, we're going to start. So what we do know that youth, our teenagers, and not just our teens, our preteens as well, our elementary school kids, they have access to a wide variety of drugs, unfortunately. So we do know that. We also know that youth do sometimes involve themselves in risky behaviors, such as using drugs and other chemicals. We also know that the earlier a person begins to use drugs, the risk becomes higher for addiction. And this is true. It doesn't necessarily mean that they're going to become addicted, but the risk becomes higher the earlier they start using drugs. And then one very important thing that I want to make sure all of you understand is that you are still the biggest influence in your child's life. I know sometimes as a parent, it does not feel that way, especially if you have children that are already in high school and they may not be having those conversations with you when they get home from school. They might be quiet or they might say just a couple of things, but do know that you are the biggest influence in your child's life. And that plays a lot in what I'm going to be focusing on. We're going to be talking about a lot of different things, but one of the things that you're going to keep hearing me repeat is building those relationships with your kids. That is very important when it comes to substance use. Spending time with them. And we're going to talk later on about those kinds of things. But some of the other things that we know, according to the Center for Disease Control and Prevention, we do know that 1 in 5 students have abused prescription medication. We'll talk a little bit more about that later. We know that 2/3 have tried alcohol at least once. And we know that about half of them have reported using marijuana in its various forms, including vapes. And 40% have tried a tobacco product. Now, I do want to say a couple of things with these particular numbers. In the last 25 years, we have seen a decrease in the use of alcohol and the use of cigarettes among teens. Why is that? And this is important to note. With those two particular substances, there has been a lot of what's called public service announcements about the dangers of those substances. You probably have seen some things on TV, advertisements on TV about nicotine use and what can happen, throat cancer and things like that. You look at the news and you'll probably see some accidents that are related to driving under the influence. And so those things really make an impact on our young people's way of thinking. And that's part of the reason why those two particular substances have decreased. When it comes to marijuana and other substances, we don't see that many public service announcements. In fact, with marijuana, there's a lot that we hear about the medicinal properties of marijuana use, and that creates in the young person's mind that marijuana is not dangerous or that there's nothing can happen, which is not true. There's a lot of things that can happen. Also, when we talk to our kids about substance use, it's important that we refer to it as substance use and not as abuse. If we say substance abuse, that implies that it's okay for them to use it, just not abuse it. So, in any use of drugs by students, by kids, by teenagers is abuse. So, we want to make sure that we talk about that or we bring that up when we talk to our kids. Fentanyl. So here, about 3 years ago, we went, and we still kind of are in a fentanyl epidemic. It has died down, it has decreased, and we'll talk a little bit more about that later. But fentanyl is still poses a danger outside or out there for our young kids. And here, let me just take a moment in giving you the difference. Fentanyl, it is a medicine, a medication that is used by doctors in hospitals. It is used as pain management, but it's used in really severe cases. Sometimes fentanyl is used in what's called end of life pain management. So it's a very, very strong and powerful drug. What we are going to talk about today here is what's called illicitly manufactured fentanyl. This is the fentanyl that is being made with other things in it by drug traffickers, and that poses an extreme danger to people in general, but to our young people specifically. So we know it is synthetic, it is man-made, it is an opioid, and it is about 50 times much stronger than heroin and about 100 times more stronger than morphine. It is a very, very, very powerful drug. It is tasteless and odorless. You see there that it is prescribed. It is prescribed by doctors, but usually it is administered in the hospital. And we also know that we have seen a lot of the deaths that we have seen, particularly among our young people, have been what are called accidental overdoses, meaning that they didn't know that what they were taking, what they were putting into their system was fentanyl. So some of the deaths that we have seen, some of our young people have thought that they were taking, let's say, Xanax, for example, and instead it was a fake Xanax pill, and it was made out of fentanyl. So it's very, very important to talk about that when we talk to our kids. There's also a type of fentanyl called rainbow fentanyl, which you'll see in a little bit. And one of the biggest dangers is that it only takes a very small quantity for fentanyl to be deadly. It doesn't have to be a quantity, a large quantity. Rainbow fentanyl, you may have seen this on TV. I know when we were in the middle of the fentanyl epidemic a few years ago, this was in the front page of news outlets. And it's a type of fentanyl made to attract our kids. If you look at it, the pills are very, very colorful. It looks like they're candy. If I am a young person, there is no way that I would think that this could kill me. And so it's very important that when we talk to our young kids, that we talk about the dangers of taking things not just from people that we don't know, but sometimes from people that we do know. It's very, very important to talk about that. The graph that you see here, the graphic that you see here, tells us about the overdose deaths by age in LA County. Now, in 2016, you see the years from 2016 to 2021. Now, up here, you see right here, you see the legend. The dark blue are the ages 17 and under. The orange ones, ages 18 and 25, the gray, 26 and 39, the yellow ones, 40 and 64, and then the light blue, 65 and up. We see, if you look at the graph, that the age group that has been mostly impacted has been those between the ages of 26 and 39 years old. But if you look at the dark blue one, we do have between 2016 and 2021 an increase in the death of people under 17. So if you look at 2016, you can hardly see the dark blue graph. There were 5 known deaths due to fentanyl during that year. But if you look as we go throughout the years, the increase by 2021, we had 31 deaths of kids under 17 years of age. So it has been quite, like I mentioned earlier, an epidemic. Now, there is good news. In 2023, there was a research done. There were some numbers that came up, and we are seeing a decrease in the number of deaths among teens, well, in general, due to fentanyl overdose. And that is directly connected to the use of naloxone, which you will hear later on in the presentation. That indeed has saved a lot of lives with the use of naloxone, and you'll be hearing about that from our co-presenters. Now we're going to see a short video, and after the video, we'll talk a little bit about it on the other side.
Hey, listen up. Too many kids nowadays are dying from drug overdoses. What you're about to hear can save your life.
Fentanyl is a deadly drug that is being made into fake pills and mixed into other drugs to drive addiction. Just one pill can kill.
Overdoses related to fentanyl have been increasing at a rapid rate here in California, mostly among young people. These cases have been growing at an alarming rate, especially here in our community.
Fake pills with fentanyl are made to look like other pharmaceuticals. These fake pills can be easily found online and contain no legitimate medicine.
Fentanyl is also made in a rainbow of colors, so it looks like candy. It only takes a small dose of fentanyl to be deadly, such as the amount found on the tip of this pencil.
Fentanyl can cause confusion, drowsiness, and dizziness, as well as other symptoms listed on the screen, which in some cases can cause respiratory failure and lead to death.
This is my son, Alexander. He died at 14 years old from fentanyl poisoning.
This is our daughter, Jessica. She was 29 years old when she was killed by fentanyl.
This is my daughter, Alex. She was murdered at 20 years old by a drug dealer who sold her a counterfeit pill made of fentanyl.
This is my son, Daniel Joseph Puerta Johnson, killed at the age of 16 by illicit fentanyl.
This is my son.
Visit DEA.gov/onepill for more information and other resources for parents and caregivers.
If you or someone you know needs help, please reach out to an adult you trust or call the county's Department of Behavioral Health Substance Use 24-hour helpline.
Please don't do drugs. We need you alive. If you're struggling with drugs, reach out and get help right away.
Thank you. So one pill can kill indeed. And then you saw how many families, how many parents have been affected and impacted by fentanyl. So as I mentioned before, fentanyl, it is a very, very powerful and potent drug. You saw there that it's more powerful than morphine, as I mentioned earlier. And in the video, you also saw how difficult it can be in being able to distinguish between an actual medication pill and a fake fentanyl pill, or Fenta pill as they call it. And then these have been the drugs that have been commonly, or I should say the medication or pills that have been commonly made to look like those pills, the Fenta pills. And we have prescription medication like Percocet, like OxyContin, Xanax. Those have been some of the most ones that have been made fake, have been made to look like those. Other drugs, heroin and cocaine, MDMA, which out in the streets is known as ecstasy or Molly, and meth, of course. Now, the drugs to watch for are marijuana, vape pens, Adderall. Now, I have not seen myself or heard from actual law enforcement or other sources that fentanyl has been found in marijuana or vape pens. However, in one of the other workshops that I did for parents in Region North, one of the parents did mention that they had heard that fentanyl had been found in vape pens. And then I also want to make this point. We are talking about fentanyl. We are talking about a very powerful drug, but we should not take our eyes off of the other drugs like marijuana, and talking to our kids about that. Just recently, there was an uptick in the use of buzz balls. Buzz balls are these colorful to attract young people, colorful bottles that's mixed with, I believe it's tequila and other things made to look like a margarita. So we had in school sites a lot of kids that were ingesting those buzz balls, and they're common. You can see them at any market if you go and buy them. But some of the kids were chugging them, and there have been some that have ended up in the hospital. So just because we're talking about this powerful drug does not mean that we shouldn't talk to them about the other drugs as well. These are some of the names in the streets that fentanyl goes by. And here I'll say that a lot of the names that we hear on the streets, a lot of the times they change from city to city, from state to state. So while, let's say, for example, in the community where I work in at Diego Rivera, the fentanyl pills are known, and I don't know if you can see it because the bar is here, but over there in that community, they're known as M30 or blues. In this community, I'm not sure what are some of the names that they go by, but as you can see there, these are just some of the names that in the streets you'll hear fentanyl go by. Social media, this is another thing that's very concerning, and a big reason why this is so concerning is because it is very difficult for you as parents and for us at the school site to keep track or to be able to see what our kids are doing in social media. We do know that some young people will go out in some social media apps like Instagram or Snapchat, and they sometimes can order some pills that they may think is Xanax or Percocet. They usually will go to a park and will do the exchange at the park. But in fact, what they may be getting is fentanyl. So it's very, very important that you as parents, as much as you can, keep track of what your kids are doing in the social media. In social media, I know, like I said, it's very difficult, and that's why it's so important for you to build or continue building relationships with your kids, so that you have that trust, so that they can trust you, and you can keep them more safe. Also, we do know that teenagers use a lot of code, sometimes coded words. Sometimes they even use emojis to talk about drugs. And one example I can give you, a smiley face. Sometimes you'll see the yellow smiley face, but the eyes will have an X on it. That means that they're talking about getting high or being under the influence. So something to be mindful of when you're seeing things like that. The other thing about social media too is it's not just that kids have access to buying drugs online, but also the things that they are exposed to when they're watching certain videos. We do know that some of these sites, including in YouTube, have videos of these influencers that are called, and sometimes the videos that they are exposed to, that they're watching, are videos where they show parties going on, where young people are doing drugs, are drinking alcohol. And to our young people, those kinds of things look like fun. Looks like I want to be there. I want to do that. At this age, our young people a lot of the times can be very easily influenced into thinking that it's not a dangerous thing to do. So it's very important that when we talk to our kids, we also talk to them about their social media, what they're doing in social media. And at this point, I'm going to stop and I'm going to ask if there are any questions that you may have at this point. Preguntas, yeah. Oh. Naloxone? It expires. Yes, it does. It has an expiration date. And we're going to have some of our co-presenters that are going to talk about naloxone. And they're going to give you a lot of good information about that, including how to use it. But it does have an expiration date. Yeah. Yeah, okay. Okay. And you'll get some information in that. But you should be able to see the expiration date on the box. Any other questions, either here in person or online? Great. So at this time, I'm going to invite my co-presenter to come up to the front.
Good morning, everyone, and happy Thursday. So my name is Grace Gillian. I'm the nursing coordinator for Region East. Region East is my second family, but I'm ready to serve you all. And I want to thank you for giving me the opportunity to be here with you for this important event. So my topic is about overdosing. So we are going to be talking about how to recognize the signs and symptoms of opioid overdose, and also what you need to do in case a person is experiencing an opioid overdose. So there are 4 R's for responding to an overdose. So, for you to remember easily, the 4 R's, the first one is to recognize the signs and symptoms, which is the important part of, identifying a person who is on an opioid overdose. The second one is respond. How you going to respond to that? And then you're going to reverse the effect of the opioid overdose. And the fourth one is to remain with a person. So on the next slide, we will be discussing the detailed information on how you are going to, what you need to do about all these R's. So the first R is recognizing the signs and symptoms. So a person may be breathing very infrequent and has stopped. So maybe they're breathing less or the breathing stops, okay? And the pulse will slow down. The person can be snoring deeply and gargling. The skin is pale and clammy. There may be a loss of consciousness. The heart rate will become slow, erratic, or non-existent, or the person can end up being unresponsive. So how are you going to respond to it? So you are going to be calling 911, which is the emergency number to call. and you're going to ask for help. You will be requesting for an advanced life support. And when you are talking on the person, the 911 person, you have to provide the exact location where you at. Okay, so it's really important for you to know the location of the incident, and you will be describing the symptoms that you have observed and not what you have suspected. And if you can try to minimize the background noises so you can be able to communicate to the 911 person clearly on all the information that they need to know. So here comes naloxone. So how are we gonna counteract the effect of opioid overdose? So the naloxone, sometimes you're gonna hear it as people will say Narcan. So it's the same medication. It's the only medication that can reverse the action of opioid overdose. So I have a box in here. Some of you may have seen it. Okay, so on each box, there are 2 doses of naloxone. So this is how it looks like. So if you have administered nasal medication before, such as the decongestant, so it's pretty much the same concept, how you're gonna administer it, okay? It will require 3 fingers. So the thumb and the 2 fingers, right?
Where the line is, the blue tick. Yes.
Oh, thank you. There's the line. Sorry. Okay. So this is the naloxone. Okay. So it has a 4 milligram. Each school has this medication. Okay. So you're gonna peel it, the back. So there is something, a piece of paper that you can pull out from here. And once it's open, I can't open this because it's not expired yet, so I don't want to waste it. So I'm just gonna show you in motion. So you're gonna pull this back until you get the device exposed, and you're gonna take out this device. So you see this is the nozzle, and there's a plunger in the bottom, the red one. So the thumb will go into the bottom, the red, and the 2 fingers will go on each side of the nozzle. Okay, and you're gonna aim the nozzle into the nostril. You can use either one of the nostril, okay? So while you're holding it, do not press the bottom until you get the nozzle into the nostril. You don't want to waste it because you only have 1 dose. When you press it, you lose the dose. Okay? So once you get into the nostril, and you're gonna press the red plunger with your thumb up. It's so easy. Anyone can do it. Okay? Okay, so after you administer the naloxone, it may require another dose of naloxone. And you know, hopefully when you call the 911, they should be on their way coming to you. And while you are waiting for the 911 call, you will be remaining or staying with the person. Okay, you're gonna be monitoring the person for their breathing, and you will put the person into a recovery position just like in the picture. Okay, it's a side lying position. You're gonna put one hand over the head to support the head, and the top leg will be bent to prevent the person from rolling over. So what is a rescue breathing? So rescue breathing is when the person is not breathing, but there is a pulse. So in that case, you will be giving one breath every 5 seconds. So when the person becomes unconscious and there is no pulse and there is no breathing, then that's when you're going to start CPR. If you are not trained to perform CPR, you can do chest compression alone. That will be a life-saving already. You don't have to give 2 breaths. Just continue pumping the chest. Will be a life-saving already until the paramedics will come. Okay, so remaining or staying with a person, just be mindful. So there is an opioid withdrawal after administering the naloxone. So there may be, the person may be saying they may have body aches, diarrhea, fever, nausea, vomiting, shivering, abdominal cramps, and there may be a risk for re-overdose. By the way, when you administer naloxone, if the person doesn't wake up, in 2 to 3 minutes, you can administer another dose of naloxone. Remember, for each box, you have 2 doses. Some other schools, they have more than 2 or 3 boxes. So use as much as you can. It's not gonna harm the person. It's a life-saving medication until the paramedics arrive, okay? So the person who's waking up after administration of naloxone, the initial response, they will appear to be terrified, confused, and disoriented. So you may want to provide some space between you and the person because they may become combative, okay? So for your safety as well, you may want to keep a distance from the person, and you will explain to the person what had happened. Okay? All right, so we know what to do. These are the things that we shouldn't be doing. So please do not slap the person or forcefully wake them up. Do not put the person into a cold bar or shower, because if they're unconscious, you know, they may not, it's a struggle and it's not gonna counteract the effect of the opioid. Do not give the person anything to eat or drink because they may just choke up. Do not inject the person with any substance that can be more harmful to the person. And do not try to make the person vomit drugs. So just to sum it up, okay? So you're gonna be calling 911 immediately from the line when possible. And then administer the naloxone. Try to keep the person awake and breathing. Lay the person on their side to prevent choking. And then always stay with the person until the paramedics arrive. So that concludes my presentation, and I'll be calling my co-administrators, Elizabeth Rodriguez. It's always good to carry a naloxone because it's a life-saving medication and anyone can administer it, and you can administer to a person who is experiencing opioid overdose. California law, it's allowing us, and you are covered by the Samaritan law, that if you have that you have naloxone in your hand and you are ready to administer it to another person with opioid overdose, then you can do that. You're welcome.
Morning. Morning, everyone. My name is Elizabeth Rodriguez. I'm a Region East Nursing Coordinator and I work with Grace. So we'll talk a little bit about Narcan, or we call it naloxone. Okay, what is Narcan? So it's a medication that can counteract the overdosing of an opioid, which it can include also those prescription medication, including heroin and fentanyl. Narcan, it only temporarily, reverses the effect of overdose from the opioids. That's why it's really very important when we are managing or we're taking care of those having overdose with opioid to call 911. Naloxone can be administered by pre-filled syringes. In one boxes, we have two pre-filled syringes on that one. Okay, naloxone is safe. Okay, there's no overdosing on that one if you administer for those with overdose with an opioid. Naloxone is a very important step. Okay, it's really very important that can save a life. Okay, so if you have those with suspected like overdosing, just administer Narcan because you can save a life. If you have naloxone, you can potentially save a life. That's what we can always encourage those ones to have the naloxone with them. Okay, naloxone district-wide. So at LUSD, all of the health office, we have Narcan. Okay, all nurses are trained to administer Narcan. And our schools, our goal is to have one school, one nurse. So we have also trained personnel, at school, a volunteer trained personnel to administer Narcan. So we train them annually. School nurses also train volunteer school staff on how to use Narcan. So that's really what we are doing. The school nurses are training the staff. It's voluntary. Usually the principal will kind of like identify those school staff that are volunteering to administer Narcan. We have also the law 2998 that allows 12 years or older to carry or administer Narcan. At the resources, we're going to discuss, we have a lot of information on the resources where you can purchase it by free. Any more questions? Yes, it can be purchased also. Yes. Yes, we have those. Yeah, we can purchase also on the online. We have some resources that we will discuss later, and it's free, no cost, and you don't even have to provide an ID to purchase it. No prescription needed.
Okay, thank you. Great information. Just a couple of things on naloxone as well. I do work at a school site, as I mentioned before, and I am one of the administrators that has been trained. I know as administrators, we do game supervision for athletic events. And whenever I supervise at home, as well as some of the other administrators, we carry our box of naloxone just in case, because you never know. That's how important it is to have some on you. The other thing I wanted to say about naloxone is naloxone does not replace for the person who was experiencing an overdose to go to the hospital. And I want to make sure that I make that distinction. Naloxone is just a temporary medicine to counteract the effects of an overdose, but that person needs to be rushed to the hospital. And I want to make sure that we make that distinction when it comes to that. I also wanted to remind everybody that you have this yellow paper, those of you who are here in person, with a QR code, and you can get a copy of these slides through the QR code. And I know some of you already have a physical copy in front of you, but you can also get a digital one. I know that we already have gone through some of the questions and answer. And now we get to the point where it says how to have a conversation. It should say how to have conversations, because it should be more than one. And it should be something that should be happening regularly. So how do we talk to kids? The first thing that I really want to say is, or talk about, is why. This is one of the questions that I usually get from parents. Why are kids using? Why are they using drugs even though they know that they may be hurtful? Well, one of the reasons why is because they can obtain these drugs easy. It's very, very easy to obtain any drug, really, including fentanyl, including other harder drugs. So that's one of the reasons. Peer pressure is another one. And here, peer pressure, I really do want to talk about peer pressure, because sometimes I feel that in my conversations that I've had with parents and including kids, sometimes I think peer pressure is misunderstood. Peer pressure, sometimes we think it's their friends kind of telling them, do it, do it, do it. Peer pressure really happens in the person's mind. So they may not be having the friends even telling them to do it, but if they see their friend doing a drug through, let's say I'm a young man, I'm a high school age kid, what might go through my head is, should I do it? Should I try to be cool like my friend? That's the peer pressure. It goes on in your kid's head. Okay, and so it's important that when you talk to them, that they hear your voice, that they hear that counter voice, so that they can make healthier decisions around that. Mm-hmm. 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 Yeah. Mm-hmm. Yeah. So the comment, thank you for saying that. Lo voy a decir en inglés porque tiene traducción, but thank you for saying that. And the parent was just commenting that sometimes friends will say to the kids, if you don't do it, then you're not man enough, or that you are not, you're a coward. Yeah, things like that, which also creates peer pressure, right? That's when they start thinking about that. And then the biggest point that I want to make is your voice. They need to hear that. They need to know that you are there, and that's why those conversations are very important. One of the other reasons that we have been seeing, and this one is directly also connected to some of the accidental overdoses that we have seen. The use of early prescription medication. And what I mean by that is we have some of our young people that either have had injuries, or maybe they have gone through some medical procedure like a surgery, and they're prescribed pain medication. And sometimes that in and of itself can cause an addiction to the prescription medication. So it's really important not to take our eyes off of that. But in relation to fentanyl, sometimes, and I know this was the case with a young man who had an injury, and he went online and he purchased what he thought was OxyContin, I believe. And when he got it, it wasn't OxyContin, it was fentanyl. It was a Fenta pill, and that's how he died. So it's really important if you have a son or a daughter that has been prescribed medication, please follow the doctor's orders. I know that in my family, it's been, we've been infamous for not following the doctor's orders. Sometimes we stop using the prescription medication without going to the doctor and asking the doctor. Or sometimes we've even gone as far as, we have a comadre or some neighbor that has a pain, and we give our pain prescribed medication to that person. That is a big no-no. That's dangerous. Prescription medication is prescribed to you with your personal health conditions and your weight and all of that. When you give prescription medication to somebody else, that may have dangerous consequences. So it's really important when we talk about prescription medication, specifically early prescription medication with our kids, that we keep in touch with our doctors and that we follow the orders that are prescribed by the doctor. And then the other thing are co-occurring mental health issues. We are seeing students, for example, with ADHD, we're seeing more and more students suffering from depression. Since even before the pandemic happened, we were seeing a lot of our young people with anxiety disorders. And this is one of the things that I want to really, really stress to you. Do not allow your children to disappear in your own home. And what do I mean by that? What I mean is, don't allow them just to go to their bedroom if they have a bedroom, and then you don't see them until the next morning. I know it can be very easy when they just go in and they bury their face in their games or their cell phones, and they don't have any interaction with the family. Don't allow that to happen at home. Have family meetings, have family dinners together, have movie nights with your children, spend time with them. When I talk about building relationships with your children, I mean all of that. I know that it's very difficult for some of our parents because they have multiple jobs, but it's so important, specifically when we're talking about substance use, that you spend time with your kids. And not all of the conversations that we're talking about has to be around drugs. Okay? They don't all have to be around drugs. It could be just how the day went. How are you doing in school? Things like that. So some of the warning signs of drug use, and I just want to mention that in and of themselves, it does not mean that they're using drugs. So I don't want anybody here to go home and, say that they have academic problems and you're using drugs. No, but they're at higher risk. Okay. And especially if you're seeing a lot of these together, that means they are at risk. It doesn't necessarily mean that they're using. And some of the things that you want to be mindful of are mood changes. Are you seeing them with different types of moods coming in? Are you seeing them changing their friends? As we go through life, especially when you're young and you're moving from one school to another, elementary, middle school, high school, sometimes you lose those friends. Sometimes you do keep your friends. It's very important for you as parents to know your kids' friends, not just their friends, to know their parents as well. It's very, very important for you to do that. Finding substances in their person. If you find a vape pen in their pockets, I've been working at the school site, at my school site, for 11 years. I've been working for the district for over 30 years. And never have I caught a student on campus with a vape pen that will tell me, yes, this is mine, mister. What is it that they tell us all the time? It's my friend's. I'm holding it for my friend. Okay? That does not, let's say it's true. Let's say that we believe them. Let's say that is true. That is still not right. That puts them more at risk of use. They have it in their persons. So trust your kids, but make sure you have those conversations with them. Don't blind yourself by saying, oh, it's especially if you find it the second time, you find it the third time, because I have seen parents like that. So make sure that those conversations are happening. Academic problems, and here, this is really, really important. A lot of the times, we see parents that are constantly coming to the school, and that's great. Often I get parents who are regulars, I call them, to the school site, and they come in apologizing to me, and I say, no, you do not need to apologize. This is what we want. We want parents to come into school. But in regards to warning signs and academic problems, do not wait until the end of the semester to come and talk to the counselor or to the teachers. The grades come out every 5 weeks. Don't wait until the last one. You look at the 5-week progress report card at the beginning of each semester. Usually their grades are high, but as they get into the 10-week, then sometimes they begin to decline. 15-week, they begin to decline. Do not wait until the 15-week. Come over and talk to the teachers, talk to the counselor, find out what's going on, because a lot of the times the teachers, will see those changes that we're talking about. Question. Thank you. Yes. And I am sure everybody here has a Parent Portal account, and I hope those of you watching virtually that you do too. And if you don't, then go to your school's parent center and they will help you open up a Parent Portal. Okay, Schoology. So these are, like I mentioned, these are some of the things to look out for. Now, the conversations, right? What are some of the things that we should keep in mind? Okay, have some goals in mind. Don't wait until you find a vape pen or something else in your child's pocket. And I've been using the word child, but I also mean high school age kids also. They're all our children, right? It doesn't matter what age they are. So have some conversations. Don't wait until you find something in their pockets. As a matter of fact, that's not the time to have a conversation. You might want to wait until you have regulated yourself emotionally, because I know that for the most part, if we find something, a drug in our kid's pocket, how are we going to respond? We're going to be angry. Sometimes we might start crying because we think it's over for them. So you might want to just wait. And especially if the child is under the influence, that is not the time to have those conversations. You want to take some time, take a deep breath, and come back later to talk to them. Once they are in a place where they can listen, and you can listen as well. Establish yourself as a reliable source. Let them know that you will be there for them. And when we talk to them, come from a place of care and love. Sometimes as parents, we come from a place of power. And what I mean by that is when you start telling your child, this is my house and you do as I say, that doesn't help them. What is it that you're telling them? That this is not their house. So be careful. What are the things that you are saying? Talk to them. Tell them how much you love them. Tell them that you care. Tell them that your responsibility as a parent is to protect them, including from using chemicals. And continue to tell them that you love them. Okay, that makes a big, big difference in terms of they listening to you and that influence that we talked about that you have. Talk to them about resources. Now, if there is, and I know as Latinos, and I can speak for my family, my generations and generations, there is a history of drug abuse in my family. And it's important that if that is the case in your family, that you talk about that with your kids. Talk to them about the history of alcohol abuse or any other type of drug and what kind of consequences that has caused in the family. They need to hear that. When there has been a history of abuse or use of alcohol and other drugs, then that puts us more at risk. It doesn't mean that we're going to become alcoholics or drug addicts. It just means that we are slightly at a higher risk, and our kids need to know that as well. And then some of the challenges. What are some of the potential challenges that we can see? Starting the conversation. At a previous workshop that I did last week, I had a parent that asked, well, how do I start? That was a question that they had. And my answer to that parent was, take this workshop. You can go home today and say, you know what, today I was at a workshop at Elizabeth Learning Center and their great parent center, and I heard this great speaker talk about drugs. And then great nursing staff talking about drugs, and they said stuff that made me think. We haven't talked. Can we talk? And then start those conversations now. Okay, so you can use this as a way to start those conversations. Now, when you talk to them, when you communicate, I should say, communication is a two-way street, right? You don't want to just talk and talk and talk and talk, because what do they say? Oh, here's another lecture. Okay, there's another lecture that's coming. So you want to be able to talk, but allow them to talk. And when you allow them to talk, I know that as parents, sometimes we think we're listening to our kids. They're talking, but in our mind, we are already thinking about what we're going to say. We already know what we're going to say. Listen to them. Listen to what they're saying. Listen to what they're telling you, because that's going to guide how you are going to react and how you are going to guide them to make better decisions. Also, don't get put off or don't let them, because I know a lot of our kids, when we start talking about things like this, what do they say? Ya lo sé. I already know. I already know that. Okay. They probably do. They probably know more than I do. But there are still some things that they don't know. And those are the things that we want to make sure that we talk to them about. And that's why I commend all of you for being here today. The fear of punishment, that's another thing, right? So they might be fearful that you're going to take away their phone. And here I want to say, I am not implying that you should not have consequences. And here I'll make the distinction between punishment and consequences. If you use the word punishment, try to change it to consequences, because punishment already has a negative connotation, whereas a consequence can have either a negative or a positive one. It depends on their actions and on their decisions. Also, if you're going to give them a consequence, give them a consequence that is realistic for you to follow. Do not threaten them and tell them, I'm going to send you to Mexico, or I'm going to send you to Guatemala or El Salvador, and then you don't do it. What happens when you do that? Then they know, oh, mi mamá or mi papá, my mom or my father, they always say that they don't do anything, or that you're going to take their phone away for a year, or if you don't do it, don't say it. Okay, be prepared. Give them a consequence that's realistic for you to follow. And do not allow them to come over, because they know you. They know your weak point. They know if they come over and start kissing you and start caressing your shoulder, that then you're going to say, okay, yeah, I know. They know you. So this is where you as a parent, this is where you have to stand your ground and say, I'm going to take your phone for 2 weeks. Let it be 2 weeks. Even if they are doing everything right after 2 days, do not give in 2 weeks, because then they're going to know, oh, you know what? My mom, my father, what they say, they do. Okay? And then you're going to see some changes there. Yes.
How should I respond if a child asks, do you not trust or believe me?
So tell them, depending, right? So if you don't trust them, be honest. Say, no, I don't trust you. And the reasons why you don't trust them. Okay, that's very, very important, is explaining why. Sometimes as parents, we just tell them to do things without telling them why. Okay, so if they ask that, do you not trust me? Well, this is the third time I've caught you with a vape pen. So no, I don't trust you. And now you have to work. We have to work together to gain your trust back. And I want you to know that I love you and I'm here to support you. Okay, so that's one of the, be honest. I think that's the biggest thing that I can tell you is be honest with your kids. I know that I know that some of us were raised with fear, right? Like a lot of our parents raised us by telling us, if you do this, you're going to die, or this is going to happen to you, right? That doesn't work anymore. We cannot threaten them, and we cannot just try to educate them by the use of fear. So be honest with them. Allow your child to speak without being interrupted. That's another thing that we kind of tend to do as parents, right? They say something that we don't agree with, and then we interrupt them, right? Don't bite your tongue, okay? Yes, let them talk, let them talk. And maybe one of the things that you want to do is what's called reflective listening. Reflective listening is when you say back what you are hearing from them to make sure that you understood. So if they tell you, Mom, today I saw a friend of mine vaping, and I kind of want to do it. How would you react to that? What would you say? Ay, te mato. I want to do this, right? So no, what I would say as a parent, if I have a son that comes and tells me, Dad, I saw a friend of mine, a really good friend of mine, and I saw him vaping, and I'm kind of curious. The first thing that I'm going to do is take a deep breath, right? And then the second thing I'm going to do is thank him. Thank you, son, for trusting me and coming and telling me. That shows that your son or daughter has a good relationship with you. And then my next thing before I start giving advice is I'm going to ask questions. I'm going to ask, why do you want to do it? You saw your friend, but did it seem like he's having a good time? So that I can start the conversation in a different way, okay? So those are some of the things that you can do to have those conversations. Now, here at the bottom, you'll see where it says, turn off the TV and put the cell phones away. Definitely. You don't want to have a conversation and you're on your cell phone, or your son or daughter is on the cell phone. But I will say that sometimes, to make a difficult conversation about drug use easier, sometimes it might be good for them or you to have some type of distraction. It makes it easier to be able to talk. But you know your kids, you know them better, so you should be mindful of all these things, okay? And it says pick a time that won't be rushed. This is not a conversation that you can have in 5 minutes, okay? So make sure that and then try not to make it a big deal, because then that's when they start shutting down. Maybe one of the things that you can do, if you're watching the news or if you're watching a movie and there is a scene where drug use is being done, maybe you can take that scene and ask your son or daughter, what do you think about that? How do you feel about that? And that might make it easier to have those conversations with them. Be aware of your body language and your facial expressions. I know sometimes we hear things and our eyebrows start, burrowing, and then they know, oh my God, my mom is getting angry, I'm going to stop, right? So you shouldn't be smiling either, right? Because then they're going to know. But be mindful of your facial expressions and your body language. The other thing is the disagreements. It's normal. Don't expect your kids to agree with everything you say. Or with half of the things you say. It's normal for your kids to disagree with you, and that is okay. So be aware of that as well. And then a couple of other things. What I get a lot of parents that I talk to in my work at my school site. And one of the things I tell parents, that a lot of the times when we want to see changes in our kids, many times we have to make changes in ourselves. And that's very important to keep in mind, okay? Those changes might be in rules that you may have at home, maybe consequences that you may or may not be giving them, responsibilities that you're giving them at home, or it might be changes in your own use. And with that, I'll say very respectfully, we are terrible sometimes at saying but not doing. And it's very important that we look at that as well. I know that, as I mentioned, in my family, sometimes, there would be a baptism where a young child is getting baptized. And one of the first things that we go get is what? Alcohol for the party. So it's not, we're not having the party for the child, we're having a party for ourselves. So it's paying attention to how we model things. Sometimes as a father, we might be talking to our son or daughter, don't drink alcohol, and then 10 minutes later, go get me a beer from the fridge. That's not modeling. It's true. We have to look at ourselves in an honest way and make those changes if we want to see those changes in our kids. Okay. So some of the other things, you know, it's more than likely. I mentioned earlier not to allow your kids to disappear in your own homes. Have family gatherings where that bonding will happen. If your kid has communication with you, if there's a bond there, trust me, your child will think twice about doing something that they know is not just going to harm them, but that is going to harm the rest of the family. And that's one of the things that you can talk to them about also, how when somebody is using and or abusing drugs, it doesn't just harm the person who's doing it, it harms everybody around them, including here at school, including here the drug use. It's something that's wide. It doesn't just stay with that one person. So talking to them about that as well. And now we're gonna go. Well, are there any questions before I call one of the co-presenters to go through the resources? Yes. ¿Dónde las agarran? ¿Dónde las hacen? Okay, so where do they make the drugs? Okay, y lo voy a contestar en inglés. So the drugs sometimes are even made in people's garage. And some of the things that they put in some of the drugs, like fentanyl or like methamphetamine, it's you even wonder why people use it, right? Because a lot of the stuff that goes in there it's poison, right? And that's exactly what we're doing. So sometimes they do it in garages, sometimes they do it in abandoned warehouses. There's a wide different places where they use it. Yeah. No other questions? Okay, so I'm going to pass it on to my co-presenter.
So we're gonna discuss about some important resources that are available in an LASD website. We have that you can click also on that website, and we have school-based clinic. We have wellness centers, and basically in this area we have Santi, we have Maces, we have also one here at Elizabeth Learning Center for those wellness center, and some of their services are mental services, could be dental, vision, or some immunization also. So there is like a number on that one is 213-241-3840. So it's available in LAUSD website. We have also early childhood mental health consultation line. It is this for those from birth to 8 years old. Weekdays from 8 to 4:30 p.m. And usually if you call that hotline, early childhood mental health, consultants, trained psychiatric social workers who are standing by to serve you. Okay, so if you have those questions about the early childhood mental health, that's the number 213-443-0165. This one is we call it Lazar app. You can download on that one on your cell phone, and you can report non-emergency incident on LUC campus. Let's say, for example, you see someone doing like some vandalism, okay? Or if you have seen someone suspected around the area of the school, maybe carrying some guns or something like that. So you can upload that on your cell phone. Okay, we have multiple resources also that you can call. Of course, the most common one is 911. If you have medical emergency, fire or medical, when law enforcement, firefighters or paramedics are needed. And usually at the school site, we call also 911. in case that we have like those medical emergency, if we have suspected students with opioid overdose. We have also 1-800-854-7771 for crisis response for teams in the field of mental health. If there's some mental health issues or substance abuse resources, you can call that number. It's 24/7, meaning 24 hours, 7 days a week. Okay. The other one is 988. Okay, those for support for suicidal crisis or mental health related distress. And 211 is for general information for local resources or linkages or referrals for health, human, and social services. Okay, if you have some more questions on that area. You can put that also in your cell phone, so it's easy for you guys for resources, in case that you need to call them, in case of emergency. Okay, this one is what we call, I know we have questions where we can get Narcan. Okay, Narcan is an over-the-counter. It doesn't need a prescription. It could be free. Okay, when you go to some of our clinics, naloxone clinics, when you go to that website, we have multiple Narcan clinics. You don't have to bring your ID, no proof of insurance, and no cost, meaning it's free. Okay, you can just walk in or call that number, and then, you can pick up a Narcan. So on that clinic, there's, sorry, I'll go back. Oh, can go back, sorry. Okay, so on that clinic, when you go to website, there's like multiple clinics that is available. So the one that's near is East LA. Okay, so the clinic is usually every Wednesday. Okay, there's one coming up on May 7, 2025 between 12 to 4. And you can jot down the address. It's 4837 East 3rd Street, LA. And there's a number also, 323-264-0155. So those are the clinics that you can obtain pre-Narcan. It could be an in-person program, and on that website it says there that when you get in and you pick up your pre-Narcan at no cost, free at all, they can show you some like a video how to administer Narcan, so you'll get some information or a knowledge how to administer it. Any question? I think that's it. My part.
So the question is about naloxone not being being safe, just in case a young child accidentally playing with a box opens it and then ingest the contents of the naloxone.
Yeah, you cannot be overdosed with Narcan when you administer it.
So it's safe to use, even including, let's say, somebody you think it's overdosing and you give them naloxone and they're not. It's not dangerous. It's safe. It's a safe medication to use.
Yeah, but the thing is, like, you can have some kind of like reaction of Narcan, like shakiness or something like that, or confusion on that one when you administer it. Okay, Narcan is non-prescribed medication. It's over the counter. Says self-carry is 12 years old and above.
So a 12-year-old legally can carry Narcan. Any other questions?
12 years old and above.
Yes. ¿Le gustaría que lo repasáramos otra vez? Okay. Okay. So you don't have your Narcan? So you have the Narcan box. If you let me have this one, 5 minutes. Okay. So I'll do this really quickly. So if you see this right here, right, you put your 2 fingers right here, okay, and your thumb will go on the plunger. Okay, the plunger is the red thing that you see there. Okay, so you put your fingers right there with your thumb on the plunger. Then you're going to take that and you're going to put it in the nostril, one of them. So once your fingers touch the nostril, then you're going to plunge it so that the contents will go in. Now there's only one, so you're going to pick one, either this one or that one. Okay, and then you go like this, and then you push it inside, and then the contents will go in. Okay, now if the first time doesn't work, you might have to do it again with the other one that's in there. Okay, that's why you have to. Okay, thanks. And I think with that, we're going to end our presentation because we don't have any more time.
Are you going to share more?
Are there any other questions?
Yeah, there's some more.
Any? Can I? So these are, I think, some of the resources that we haven't gone through, and some of these are the LA County Substance Abuse Service Helpline. You see that the helpline is open 24 hours. You also have the Suicide Crisis Lifeline, formerly known as the National Suicide Prevention Lifeline, and that's the 988 number that you saw there. You also have the Department of Mental Health, access to also a hotline, and you see that all of these are hotlines that are available 24 hours, okay? And then, of course, you have the national hotline, free and confidential referrals that you see there as well. And this is just the Spanish version of what we just went through. And I think with that, if there are any other questions, we'll take those. If not, I'm going to, yes. Yes. Yeah. So the question is, if my daughter has a friend who is abusing drugs, but their parents are not there for him or her to help them and support him, can they use any of these hotlines and resources to get help? And the answer is yes. So maybe your daughter, as a good friend, can talk to him or her and encourage them to reach out to the hotline as well. Absolutely. Any other questions?
On the webinar. Yeah. But we can stick around for the folks in person. Yeah, we can stick around for the folks in person. But we want to make sure that we finish the slides for the webinar, and because our interpreter will only be here till 10:30. So we're going to go ahead and just go through these last. If you could take a moment to fill out the evaluation, especially if you're on our webinar. We have over 100 people participating and watching from different school sites or your home. And we're so glad that you joined us today for this important presentation. So if you could take a moment to fill out the evaluation for today, we'll drop that link in the chat so that you can let us know about your learning today. Thank you so much. And for those of you here, we can come back to this if you want to fill that out. Also, please know that this is part of a series of workshops for our Family Academy. We have a variety of topics presented both at the Central District level as well as at our region level. So please, we hope that you'll continue to join us for other upcoming topics that we have. So for example, here's an important topic that many of our families are struggling to be prepared with changing policies about immigration and rules in this country. And we want to encourage our families to be prepared for any situation, whether it's peer pressure and mental health and drug use, or whether it's immigration issues and having a plan. It's always good to have a plan, right? Like today, you're preparing yourself to have a plan for these hard conversations with our kids. We want to invite you to join us at this Family Academy, Thursday, May 8th. That's also on the website. And also, upcoming Friday, May 16th, there will be a hybrid opportunity, both in person and online, to learn about the Title I programs in our district, academic programs for our kids in math and English. And this is going to be an excellent morning of learning. Region East will be there supporting, and we hope to see you either in person or online. Maybe Elizabeth Learning Center can come together and watch together again. We love being here. For Region East, we will be at Huntington Park Elementary School next week talking about math at bedtime. So that's a very different topic than what we did today, but just ways to engage in math learning during your bedtime routines for elementary students. So that will be fun. We'll learn together at Huntington Park or join us on Zoom. We also wanted to make sure that there are resources for our families. We'll drop those in the chat as well. All of the We Are One information is available to our families to know where to get resources about legal support, immigration, legal support for yourself, for your loved ones, for your neighbors and community. We want to thank you all for being with us here today. I'm going to put the, oh, no, I can't go back. I wanted to put the evaluation slide back up there. Yeah, no puedo. Oh, there we go. If you could fill out the evaluation. Thank you again. I wanted to thank again Elizabeth Learning Center for hosting us here today. Gracias a la Escuela Elizabeth Learning Center por ser nuestros Gracias. And I want to thank our interpreter, Miss Natalie. Thank you for your work today for interpreting this difficult content and for providing that service to our families. Thank you for being with us. Thank you. To our team, to everyone here, to our presenters, Senor Roque, our nurses here today. Thank you so much. Very important. And I want to just say one thing before we close. I know a lot of parents online were asking, you know, can I just show this to my kid? Like, can someone just show this presentation to my child and then they can learn about it? And I think that the message here is not like push and play, but it's about, I know you, I see you, I want to learn about you and hear you. And that's where the key work starts, right? They're going to learn from that relationship with you or with another adult. It might not be you, but it's another adult that they trust, that they will learn from. So just remember, it's hard. And I'm a mom too. And I have to remember to take a breath and be curious and have hard conversations. And I would rather just, can you sit down and watch this video and learn? But I know that it's that relationship, that de por vida, that's going to matter. So anyway, I encourage you, parents, be encouraged and know that you are the most important person to your children. Thank you for being here today. Thank you. I did.